Welcome back to the channel. If you're a first-year medical student, you're in the right place. In this video, we're exploring one of the most essential and high-yield topics in anatomy, the skin. It's the largest organ in your body and plays key roles in protection, sensation, thermoregulation, and even immune defense. Whether you're reviewing for exams or trying to connect the dots clinically, this 10-minute breakdown will give you exactly what you need. Let's dive right in, starting with the basic structure and layers of the skin. The skin is a truly remarkable organ. It is, in fact, the largest organ. Your entire body is covered by it. It forms a continuous external surface. This surface faces the outside world daily. It weighs a significant amount, about 7% of your total body weight. It is an impressive, extensive system. The skin plays a vital role. It helps maintain your body's balance. This balance is called homeostasis. The skin acts as a primary shield. It guards against many external threats. This includes germs and physical injury. Without skin, life would be impossible. Its integrity is crucial for health. For medical students, skin knowledge is key. Understanding its anatomy is fundamental. This forms a solid foundation for diagnosing many different conditions and for treating these varied ailments. Many diseases affect the skin directly, while others show signs on the skin. So the study of the skin is essential. This essay will guide your learning. We will explore its many layers. We will discuss its important functions. Skin appendages will also be covered. Its histology will be made clear. Clinical relevance is a major focus. Our aim is comprehensive understanding presented in an accessible, clear way. One major function of skin is protection. It forms a tough physical barrier. Keratin protein makes skin strong. It also has chemical barrier functions. The acid mantle helps fight bacteria. Melanin pigment protects from UV rays. Biological barriers include immune cells. These cells patrol the skin for invaders. Skin is vital for sensation. It contains many types of receptors. These receptors detect different stimuli. You can feel touch and pressure. You can sense heat and cold. Pain receptors warn you of danger. This allows interaction with your world. It helps you avoid harmful things. Thermoregulation is another key role. Skin helps control body temperature. Blood vessels in the skin constrict when you are cold. They dilate when you are hot. Sweat glands produce sweat to cool you. Evaporation of sweat cools the surface. This maintains stable internal temperatures. Skin is involved in metabolism. It synthesizes vitamin D when exposed to sunlight. Vitamin D is crucial for calcium absorption. Skin also performs minor excretion. Small amounts of waste leave in sweat. Limited absorption of substances can occur. For example, some medications in patches. The epidermis is the skin's top layer. It is the most superficial part. This layer does not have blood vessels. It is considered avascular. Keratinocytes are its main cell type. These cells produce tough keratin. The epidermis has several sublayers, each with specific functions. The deepest sublayer is stratum basale, also called stratum germinativum. New skin cells are made here. This layer rests on the basement membrane. Melanocytes are found in this layer. They produce the pigment melanin. Merkel cells, for touch, are also present. Cell division is very active here. Above the basale is stratum spinosum. Cells here have a spiny look due to desmosomes, which are anchoring junctions. Next is the stratum granulosum. Cells in this layer contain granules that hold keratin precursors and waterproofing lipids. The stratum lucidum is next sometimes. It is only found in thick skin, like on your palms and soles. Finally, the stratum corneum is outermost. It consists of dead, flat cells full of keratin, providing a tough protective coat. These cells are constantly shed. Beneath the epidermis lies the dermis. The dermis is a strong, flexible layer. It is rich in blood vessels and has many nerve fibers. Connective tissue makes up the dermis, including collagen and elastin fibers. Collagen provides strength to the skin, while elastin allows the skin to stretch. The dermis has two main layers. The upper layer is the papillary layer, which has peg-like dermal papillae projecting into the epidermis above. They form ridges for fingerprints. This layer contains Meissner's corpuscles, touch receptors for light touch. It is made of loose areolar tissue. The lower layer is the reticular layer. It is much thicker than the papillary layer and consists of dense, irregular connective tissue. This gives the skin great strength and good elasticity. Larger blood vessels are found here, along with nerves and glands. Hair follicles originate in this layer. The hypodermis is below the dermis, also called subcutaneous tissue. Technically, it's not part of the skin. It anchors skin to muscles beneath. It is made of adipose tissue and areolar connective tissue too. It acts as a shock absorber, insulates and stores energy. Section 5. Essential extras, skin appendages and their functions. Skin appendages are accessory structures. They originate from the epidermis, but they extend down into the dermis. Major appendages include hair follicles. Sebaceous glands are also appendages. Sweat glands and nails are important too. Each has a specific role to play, and they contribute to the skin's overall function. Hair follicles produce hairs. A hair has a root and a shaft. The follicle is a sheath of cells. Hair provides some protection and can sense light touch. Erector pili muscles attach to follicles. They make hair stand on end, causing goosebumps when cold. Sebaceous glands are oil glands. They are usually connected to hair follicles. They produce an oily substance called sebum. Sebum lubricates the hair and skin. It helps keep the skin waterproof and has some antibacterial properties. It prevents skin from drying out. Sweat glands help regulate temperature. There are two main types. Eccrine glands are found all over and produce watery sweat for cooling. Apocrine glands are in axillary areas and anogenital regions too. Their secretions are thicker with proteins. Nails protect finger and toe tips. Section 6. A microscopic view, histology of thick and thin skin. Histology is the study of tissues. It examines tissues at a microscopic level. Understanding skin histology is important. It reveals its detailed structure. Skin is classified as thick or thin. This classification is based on the epidermis, specifically the thickness of the epidermis. Their locations and features differ. Thick skin is on the palms and soles. It experiences a lot of friction. Its epidermis has 5 distinct layers. This includes the stratum lucidum. The stratum corneum is very thick. Thick skin does not have hair. It also lacks sebaceous glands, but it has many sweat glands. Thin skin covers most of the body. Its epidermis has only 4 layers. The stratum lucidum is absent here. The stratum corneum is much thinner compared to that of thick skin. Thin skin contains hair follicles. It also has sebaceous glands. Sweat glands are present as well. Several key cell types are crucial. Keratinocytes are the most abundant. They produce the protein keratin. Melanocytes produce melanin pigment. Melanin protects from UV radiation. Langerhans cells are immune cells. They help defend against pathogens. Merkel cells are sensory receptors for touch. Section 7. When things go wrong, common skin conditions. Understanding skin anatomy is crucial. It helps in diagnosing skin problems. Skin disorders are very common. They can range from mild to severe. Many factors can cause them. These include genetics and environment, also infections and immune responses. Recognizing them early is important. Psoriasis is a chronic condition. It causes rapid skin cell growth. This leads to thick, scaly patches. These patches are called plaques. Eczema, or dermatitis, is inflammation. It makes skin red, itchy, and dry. Various triggers can cause eczema. Both involve epidermal and dermal changes. Melanoma is a serious skin cancer. It develops from melanocytes. These are the pigment-producing cells. Early detection is very important. The ABCD rule helps identify it. Asymmetry, border, color, diameter, evolving. Histologically, atypical cells invade deeper. It can spread if not treated. Burns are injuries to the skin. They're caused by heat or chemicals or electricity or radiation. Burns are classified by their depth. First-degree burns affect the epidermis only. Second-degree involve the epidermis and dermis. Third-degree destroy all skin layers. Immediate care prevents complications. Section 8. The skin as a mirror reflecting systemic health. The skin often shows internal health. Changes in skin can be clues. They may indicate underlying diseases. The skin is easily accessible. This makes it a useful diagnostic window. Doctors look for these signs to understand a patient's overall health. Many systemic issues have skin signs. Lupus is an autoimmune disease. It can cause a butterfly-shaped rash. This malar rash appears on the face. Photosensitivity is also common. Scleroderma is another autoimmune condition. It causes skin to thicken and harden. This is due to excess collagen. Skin changes can be very distinctive. Jaundice causes yellowing of the skin and the whites of the eyes. It is due to bilirubin buildup. This often indicates liver problems. Cyanosis makes the skin appear bluish. This is from low oxygen in the blood. It can signal heart or lung issues. These color changes are significant. Diabetes mellitus can affect the skin. It may cause diabetic dermopathy. These are light brown scaly patches, often appearing on the shins. Acanthosis nigricans is another sign. It shows as dark, velvety skin. Poor wound healing is common. Increased infections also occur often. Section 9, Conclusion, the indispensable knowledge of skin anatomy. The skin is truly a complex organ. It is also incredibly vital. We have seen its many layers and its diverse essential functions, from protection to sensation and thermoregulation to metabolism. It is much more than a cover. It is an active, dynamic system. Understanding skin is not just academic. Its anatomy, histology, and physiology are essential for medical practice. This knowledge is a powerful tool for every healthcare professional, especially for aspiring doctors. It underpins many clinical skills. It helps in patient assessment. This understanding allows diagnosis of a wide array of conditions. Some are localized to the skin, like acne or simple rashes. Others are systemic diseases. These show signs on the skin. Recognizing these is very important for timely and effective treatment, so appreciate the skin's intricacies. Medical students should study it well. This knowledge will serve you greatly throughout your future medical careers. It helps provide holistic patient care. The skin tells many stories. Learning to read them is key. Mastering skin anatomy is rewarding.